Well, the symptoms are quite similar to what you find in flu or what you find in a common respiratory illness. You could find fever, cough, catarrh, or difficulty in breathing. So that's why we need to be careful, because most of us would have people around us that have had some of this common cold before, and will sneeze, will cough, and all that. And it's easy for us to look down on it. But now we have to have an high index of suspicion, especially if that person has visited, is coming back from many of these countries where there are community transmissions, or if the person has been in contact with someone that has have been confirmed to have coronavirus. So we have to be very careful, because these symptoms are quite
Tell us
similar.
how it's spread from the symptoms. How is it spread?
Okay, coronavirus is majorly spread by droplet infection. Okay, for example, a person that has the virus, when the person coughs or sneezes, and the person beside him inhales or gets in contact with those droplets. That's how it can spread quite easily. Or someone touches the droplets, and most people, when they touch things, they put it on their face, and that from there they can introduce it into their nostrils.
It's actually hard. Phases of it. Yes. Okay. So Dr. Babarinsa, who is that risk of developing severe illness of coronavirus?
Well, it's important we first know that everyone is at risk to a certain extent. It's, as we speak as of today, 80 countries are affected already. But from the research, from what we know,
3,000
yes,
deaths.
over 3,000 deaths and 90,000 cases, over 9,000 cases. From what we know, most of the deaths that have occurred, over 80% of the deaths that have occurred in people older than 60 years. And that's very, very significant. So that shows that people that are over 60 years are at risk of the severe aspect of the disease. And it's also interesting to note that we're told about 75% of these elderly people are elderly people that have coexisting medical conditions like heart problems and different chronic diseases. So it's important we understand that number one,
their immune system.
Yes, their immune system is already compromised. So number one, those that are elderly are at more risk. Those that have chronic conditions like kidney disease, heart disease, and all that are at more risk. But we should also know that we are all at risk. So we should, why we should pay more attention to those people. Everybody, in a way, it's at risk. And people that live in such regions and in China or countries where there is
gang, this bed gang. And then he had it wasn't covering his bed, and a doctor said he wasn't wearing it properly. Can you tell us how to properly wear the nose mask, Dr.
Well, that's very important, because even WHO has released videos on how to wear the face masks properly. First is that the person should have, it's always good to wash your hands before doing anything like that. Second is that there's a spring sort of on the top of the face mask that you use to adjust the face mask on your nose, so that it's held closely to your nose. And also make sure that you tie it as usual to the back of your head and all that. And it's very, very important that you avoid contact. You make sure your hand avoids contact with the front of the face mask. Yes, because you are assuming, and although this is more especially after you have worn it, because you're assuming that the front can be infected. And this also applies to when you want to take it off. When you want to take it off, you make sure that you take it off. You don't allow your hands to touch the front of the face mask, because you could have gotten infection from different places, and you dispose it. And it's also important into a waste bin. Into a waste bin. Well, it should be. Because of course we're trying to be careful here, but ideally a regular waste bin should be covered, and all that. And in some sophisticated, some more developed parts of the world, your waste bins, once you put the dirt on top of it, it opens by itself and closes.